So this is a basic setup. I've got my bib clips and my bib, glasses that I make all my patients wear because I do have loops and a light that shines really bright, so I like to cover my patients. I put Vaseline on all of my patients' lips just to keep them more comfortable. I just use a cotton tip, really handy, and then I keep my floss handy, got my timer so that I know where my timing's at. I already opened up my instruments just to make them a little more accessible. These are my favorites to start out with, like I said, and then I kind of go from there and see what else I need. Of course, a mouth mirror, just to see behind every nook and cranny in the mouth. My air water syringe. This is the type of Explorer that I have. It's just a shepherd's hook, and then on the other side is a probe so that I can do all of my measurings, the 232, 334. That is what helps me know the depth of my patients, their gum tissues, how healthy, how inflamed, so I know where I need to work harder and where they need to work harder. I'm trying to get this into focus, sorry guys. So that's that. My first one that I always kind of start out with is just a universal. It's just a double edge on each side. This is made by Hugh Freedy, and it is the SC13147. Great instrument. And then I also really enjoy, so that gets in every nook and cranny and gets calculus that's really high in the contacts. This instrument also by Hugh Freedy, and it's an EverEdge. I love their EverEdge series of instruments. It really does stay sharp, so I really like that. So this one is a posterior sickle. Fits into every little nook and cranny in the mouth and really can kind of get a lot of grime. Really great. And then I just like to keep a normal sickle on hand. That's just a really kind of normal hook sickle, and this little edge is just really tiny and it kind of fits tight into the contacts also. I like that. So that's just what I use for basically all my patients, and then I also keep close by this little bin that has other instruments. Some of my basic cassettes don't even come with like this posterior sickle that I really love, so I have a couple of those on hand. And then I always kept an extra set because every once in a while you drop a mirror, or it doesn't have an air water syringe, or sometimes I do need a Gracie on just a patient that I'm only going to see for a prophy, and I just need some extra tools. But I don't need that with everybody. I like to keep these. These are not sterilized right now because I had just opened a couple of sets to sharpen, but these are sharpening stones. I like this gray one. It's really light. I forget who it's made by, but it's really great for like maintenance, just doing making sure you're really keeping up on your sharpening. It's really fine. Like you really have to kind of go at it in order to get a good edge. This one's a little more grainy and a little more coarse and rough, but that is great for when instruments haven't been sharpened in a while, just to kind of get them where you need them to be. And then if you're doing a good job, the maintenance one is really great. That is how I kind of personalize all of my great stuff. That is how I personalize my care for all of my patients. I love my job, and I just want to keep sharing with people how to, one, be a great dental hygienist, and how to personalize your treatment for them. Thanks guys, hope you enjoyed the video.